In this animation, each parent is a carrier for the same autosomal recessive condition. A parent passes on one or other of each pair of their chromosomes to a child. Which one they pass on is due to chance. There are therefore 4 possible combinations of chromosomes which the children of this couple could inherit. The first combination shows a child who has inherited a chromosome with the usual gene from each parent. He or she will not have the condition and will not pass on the altered gene for the condition to his or her children. When a child inherits one copy of the usual gene and one copy of the gene alteration, he or she is a carrier for the condition like their parents. When a child has inherited a gene alteration from both parents, he or she will have the condition. So where both parents are carriers, at conception each child has a 1 in 4 or 25% chance of inheriting 2 copies of the usual gene and of being neither a carrier nor having the condition. There are 2 chances out of 4, or 50%, that at conception a child will inherit 1 copy of the usual gene and 1 copy of the altered gene, and so will be a carrier for the condition. There is a 1 in 4 or 25% chance that a child will inherit a copy of the altered gene from each parent, and so inherit the condition. As each one of the 4 possible outcomes shown here is equally likely, in each pregnancy there is a 1 in 4 or 25% chance that a child will inherit the autosomal recessive condition. It can sometimes be important to explain to parents that as chance has no memory, the 1 in 4 probability of inheriting 2 copies of the altered gene for the condition applies each time 2 parents who are carriers decide to have a child, irrespective of how many children they may already have who have or do not have the condition.